Hi, I'm Dr. Brian Strother with Corrective Chiropractic Clinic in New Buffalo, Michigan. Today we're going to talk about neck pain, headaches, and even arm pain. One of the things that's super important in our office is that when people arrive, we have a conversation, a consultation about their specific problems. We want to figure out if we can help them. If we can't, we let them know. But if we can, what we typically do is a comprehensive examination, high-tech testing, and digital x-ray. Once we've collected all that information, we put it together to make sure and confirm that we can help and what the treatment plan will be. We review that with patients so they understand their condition and all the tools we're going to use and what the treatment plan entails. So today we're going to talk about Rose's condition. Rose had an interesting situation where she was up at a big truck that had the hood up. She walked up to the truck, the hood failed and came down upon her head and it compressed her neck, and that was not a good day.
That was definitely not a good day.
So what kind of symptoms did you have?
Well, right away, I had a major headache. I felt like I had a concussion. I had all the symptoms of that. But then after that, I was getting headaches every single day, migraines, severe neck pain on the left side, and even numbness down my hand, down my arm and into my fingers.
So in this situation, we wanted to make sure we ruled out any kind of compression fracture. But what had actually happened is on the x-ray, we saw that she had compressed her disc. And so one of the treatment tools that we used was decompressive traction. So I want to show you that today, and we'll show you the other part of her treatment plan in just a minute. So I'm going to have you go ahead and lay down on your back. So when she compressed that disc, what will typically happen, and let me get this so that we're not pinching your hair, okay? There we go. And this is all soft, so it's very comfortable for her. This is all attached to a computer, and it will pull to create a decompressive traction on the disc. And so we set the amount of pounds of pull, and it goes through a compressive cycle where it'll go a little bit down and then up. So it pumps. And what happens is that when that disc is pushed out on the nerve, then we start pulling it in, and that actually helps exchange fluid in the disc through the bone marrow. When that disc starts coming off the nerve, just the weight of a dime will make a big difference in our symptoms. We always want to make sure we make a full correction, and that's why our treatment plans are comprehensive. So what we do is we hit start, she goes through, it takes about 15 minutes, and then when she's done with that, she comes in for her adjustment, and we'll go there next. So Rose has completed her spinal decompression, and now she's over here for her spinal adjustment. When we go through a spinal adjustment, there's a very specific method of analysis that's done on each visit. When we're going to address her neck, there's a number of different ways we can choose to adjust based on the condition. We can do low force technique, we can do table assisted technique, and we can do traditional by hand technique. Each one is based on where the person's at in care and can change as they go along. We have other tools in the office that can help along the way too, that help decrease inflammation right before adjustment or right after an adjustment to help make sure that the patient's moving forward. Now with Rose, she specifically had a C6 issue, and C6 is down here in the neck, and it goes down the arm into the hand. So when we're going to